Polycystic Ovary Syndrome, PCOS, is a common hormonal disorder. It can lead to irregular periods, increased hair growth, acne, and difficulty getting pregnant. Treatment options vary depending on whether pregnancy is desired. Individuals with PCOS may also have a greater risk of developing health issues, such as diabetes and high blood pressure. What is polycystic ovary syndrome, PCOS? Polycystic ovary syndrome, PCOS, is a hormonal disorder that develops when the ovaries, the organs responsible for producing and releasing eggs, make an excess amount of certain hormones. In people with PCOS, the ovaries produce higher than normal levels of hormones called androgens. This hormonal imbalance disrupts the normal reproductive cycle. As a result, individuals with PCOS often experience irregular periods, skipped menstrual cycles, and unpredictable ovulation. Because ovulation may not occur regularly, a condition called anovulation, small fluid-filled sacs containing immature eggs may appear on the ovaries during an ultrasound. However, despite the name polycystic, having cysts on the ovaries is not required for a PCOS diagnosis. These cysts are typically harmless and not painful. PCOS is one of the leading causes of infertility in females and can also raise the risk of other health problems. Treatment depends on your specific symptoms and whether you are trying to conceive. At what age does PCOS begin? PCOS can develop anytime after puberty. Most individuals are diagnosed in their 20s or 30s, often when they seek medical help for difficulty becoming pregnant. The risk may be higher if you have obesity or a family history of PCOS. Symptoms and causes. What are the signs and symptoms of PCOS? Common signs and symptoms include irregular menstrual cycles. This may involve missed periods, infrequent periods, or very heavy bleeding. Excess hair growth, hirsutism, increased hair growth on the face, chest, abdomen, or arms occurs in up to 70% of people with PCOS. Acne, breakouts may appear on the face, chest, and back and can persist beyond the teenage years. Obesity, between 40% and 80% of individuals with PCOS have obesity and may struggle to maintain a healthy weight. Darkened skin patches, areas of darker skin, especially around the neck, underarms, groin, or beneath the breasts, a condition known as acanthosis nigricans. Ovarian changes, enlarged ovaries or multiple follicles may be seen on ultrasound. Skin tags, small pieces of extra skin, often found on the neck or in the underarm area. Thinning hair, hair loss, or male pattern baldness may occur. Infertility, because ovulation may not happen regularly. PCOS is a common cause of difficulty getting pregnant. Can you have PCOS without symptoms? Yes, it's possible to have PCOS without noticeable symptoms. Some people only discover they have the condition when they struggle with infertility or unexplained weight gain. Others may have mild symptoms that go unnoticed. What causes PCOS? The exact cause of PCOS is not fully understood, but genetics appear to play a role. Several contributing factors have been identified, with obesity being a significant one. Elevated androgen levels. Higher levels of male hormones can prevent the ovaries from releasing eggs properly, leading to irregular periods. This disruption can also cause small cysts to form on the ovaries. Increased androgens contribute to acne and excessive hair growth. PCOS is a complex condition influenced by hormonal, genetic, and lifestyle factors. What are the signs and symptoms of PCOS? Common signs and symptoms include irregular menstrual cycles. This may involve missed periods, infrequent periods, or very heavy bleeding. Excess hair growth, hirsutism, increased hair growth on the face, chest, abdomen, or arms occurs in up to 70% of people with PCOS. Acne, breakouts may appear on the face, chest, and back and can persist beyond the teenage years. Obesity, between 40% and 80% of individuals with PCOS have obesity and may struggle to maintain a healthy weight. Darkened skin patches, areas of darker skin, especially around the neck, underarms, groin, or beneath the breasts, a condition known as acanthosis nigricans. Ovarian changes, enlarged ovaries or multiple follicles may be seen on ultrasound. Skin tags, small pieces of extra skin, often found on the neck or in the underarm area. Thinning hair, hair loss, or male pattern baldness may occur. Infertility, because ovulation may not happen regularly. PCOS is a common cause of difficulty getting pregnant. How is PCOS different from endometriosis? Although both PCOS and endometriosis can lead to ovarian cysts and fertility challenges, they are separate conditions. Endometriosis occurs when tissue similar to the lining of the uterus grows outside the uterus, such as on the ovaries, fallopian tubes, or vagina. It often causes pelvic pain and severe menstrual cramps. PCOS, on the other hand, is a hormonal disorder characterized by irregular periods, inconsistent ovulation, and physical symptoms related to elevated male hormones. Which hormones are involved in PCOS? PCOS is linked to a hormonal imbalance that affects the menstrual cycle, ovulation, and sometimes fertility. The reproductive system depends on a delicate balance of hormones, and when that balance is disrupted, symptoms can develop. Key hormones involved in PCOS include androgens such as testosterone and androstenedione, luteinizing hormone (LH), follicle-stimulating hormone (FSH), estrogen, progesterone, insulin. When to see a healthcare provider. Seek medical advice if you experience irregular or very long menstrual cycles, more than 40 days between periods, excess hair growth or persistent acne, difficulty becoming pregnant. Early diagnosis and treatment can help you better manage PCOS and protect your long-term health. You're planning to become pregnant now or later. PCOS treatment options may include ovulation-inducing medications. Since pregnancy begins with ovulation, certain medications can stimulate the release of an egg in people with PCOS. Clomiphene and letrozole are oral medications commonly used for this purpose, while gonadotropins are administered through injections. Surgical treatment, a minor surgical procedure, may help trigger ovulation by removing small amounts of ovarian tissue responsible for producing excess androgens. However, this approach is less common today because effective medications are widely available. In vitro fertilization, IVF. If medications don't successfully stimulate ovulation, IVF may be recommended. This process involves fertilizing an egg with sperm in a laboratory and then placing the embryo into the uterus. Does PCOS go away? There is currently no cure for PCOS, but healthcare providers can help manage and control its symptoms. Over time, symptoms may change or become less noticeable, but the condition itself does not permanently disappear. Can you have PCOS during menopause? Hormonal changes that occur during menopause often reduce or resolve many PCOS symptoms. Regardless of age, if symptoms interfere with your daily life, it's important to consult your healthcare provider. Is pregnancy possible with PCOS? Yes, it's possible to become pregnant if you have PCOS, although the condition can make conception more challenging and may increase the risk of certain pregnancy complications. Many individuals with PCOS conceive naturally. Your healthcare provider can create a personalized treatment plan to support ovulation, which may include medications or assisted reproductive methods like IVF. Discussing your treatment options with your provider can help you better understand your plan and improve your chances of having a healthy pregnancy. Management and treatment. How is PCOS treated? Treatment depends on your symptoms, overall health, and whether you plan to become pregnant. Options may include medication, lifestyle adjustments, or both. If pregnancy is not desired, treatment options include hormonal birth control pills, patches, injections, vaginal rings, or intrauterine devices, IUDs, can help regulate menstrual cycles. Some types may also reduce acne and unwanted hair growth. Insulin sensitizing medication. Metformin, commonly used to treat diabetes, helps the body use insulin more effectively. When insulin levels improve, menstrual cycles may become more regular. Anti-androgen medications. Certain medications reduce the effects of androgens, helping to manage acne and excessive hair growth. Your healthcare provider can determine if this option is suitable for you. Lifestyle modifications. Following a balanced, nutritious diet and maintaining a healthy weight can improve insulin levels and reduce symptoms associated with PCOS. Thank you for watching Anatomy of Life. Don't forget to like, subscribe, and share this